Home monitoring of COVID-19 patient. If you are caring for someone with COVID-19, follow this advice to protect yourself and others. Learn what to do when someone has symptoms of COVID-19, or when someone has been diagnosed with the virus. 1. Always follow doctor's advice. For most people, symptoms last a few days, and people usually feel better after a week. The caregiver should not be someone who is at higher risk for getting COVID-19. 2. If there is fever above 100°F, give paracetamol tablet. 3. Make sure the person who is sick drinks a lot of fluids and rests. 4. Consider getting all essential items to be delivered at home. Try not to go outside your house. 5. Watch for the warning signs: breathing trouble, persistent pain or pressure on the chest, confusion, drowsiness. If you notice any unusual symptoms, apart from the ones mentioned, inform your treating physician. 6. COVID-19 spreads between people who are in close contact, within about 6 feet, through respiratory droplets, created when someone talks, coughs or sneezes. 7. If possible, have the person who is COVID positive use a separate bedroom and bathroom. Try to stay at least 6 feet away from the person. 8. If you have to share space, make sure the room has good airflow. Open the window to increase air circulation. Improving ventilation helps remove respiratory droplets from the air. 9. The person who is COVID positive should eat in a room, if possible. Handle any dishes, cups and glasses, or other utensils used by the COVID positive person with gloves. Wash them with soap and hot water. 10. Do not share dishes, cups or glasses, silverware, towels, bedding, or electronics, like a cell phone, with the person who is COVID positive. 11. The person who is COVID positive should wear a cloth mask when they are with any other person. The mask covering helps prevent a person who positive from spreading the virus to others. It keeps respiratory droplets contained and from reaching other people. Masks should be changed daily. 12. Cloth mask coverings should not be placed on young children, under age 2, anyone who has trouble breathing, or is not able to remove the covering without help. 13. Caregivers must wear gloves when you touch or have contact with the sick person's blood, stool, or body fluids, such as saliva, mucus, vomit, and urine. Throw out gloves into a separate trash, and wash hands with soap water right away. The caregiver must also wear a cloth mask. 14. Wash your hands, often with soap and water, for at least 20 seconds. Tell everyone in the home to do the same, especially after being near the person who is sick. If soap and water are not readily available, use a hand sanitizer that contains at least 70% alcohol. Cover all surfaces of your hands, and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. 15. Clean and disinfect tourist surfaces and items every day. This includes tables, doorknobs, light switches, handles, desks, toilets, mobiles, gadgets, and electronics. Clean the area or item with soap and water if it is dirty. Use alcohol-based wipes or spray sanitizer containing at least 70% alcohol for areas where soap water application is not possible. 16. Caregivers should stay home and monitor their health for COVID-19 symptoms while caring for the person who is sick. It is advisable that a pulse oximeter, incentive spirometry, and steam inhaler be kept in the room. COVID-positive person should do spirometry and steam inhalation daily, and check oxygen saturation with pulse oximeter. If saturation drops below 92%, then physician should be informed immediately. 17. They should also continue to stay home after care is complete. Caregivers can leave their home 14 days after their last close contact with the person who is positive, or 14 days after the person who is sick starts home isolation.